everyone, Namaskar. Today we are here to bring awareness towards breast cancer. I have my team of nurse practitioner students. We're gonna ask them some questions that will all relate to breast cancer and how to screen and how to prevent them. So I will start with Lauren. Lauren, what would you say about breast cancer in Nepal?
So, breast cancer is the second leading cause of cancer in women in Nepal, second only to cervical cancer. But currently, there is no national or regional breast cancer screening program in Nepal.
So that makes it very important for us to bring the awareness. As a healthcare provider, I believe in prevention and promoting health. So we really need to put a program together where we can bring the breast health and breast cancer prevention. Knowing about breast cancer, I would like to bring in some guidelines that we practice here in USA to prevent breast cancer, and I'm gonna have Lakeisha talk about current guidelines on breast cancer screening.
According to the American Cancer Society, they state that breast cancer screening should be done from age 40 to 44 for potential benefits to prevent those patients that have breast cancer. Also, patients that are 45 to 54 should get their mammogram done every year. And at age 55, they should get their mammogram done every 2 years, but a provider should be consulted.
Okay, very nice. Thank you. So breast cancer screening can be done at any age if you have risk factors that I'm gonna have Christina talk about. But breast cancer screening in America is advisable from the age of 45 to 54 every year, and after 54 it's every 2 years. But we can always do screening as needed basis. I have done breast cancer screening even in ages 17, 18 and 19, so it all depends on risk factor and individual cases. Now I'm gonna have Derek talk about worldwide statistics on breast cancer.
So breast cancer is the worldwide the leading cancer in all females, the second most common cancer of all types of cancer, and there's estimated 2 million cases to be diagnosed this year alone.
Thank you, Derek. So you could tell from his statistics that we found on CDC website that this is pretty common, and like Lauren mentioned, that this is the second most common cause of death in Nepal, second to cancer. Am I right, Lauren?
Second to cervical.
Second to cervical cancer. So let's talk about risk factor. What should we look for when we are looking for breast cancer prevention to bring the awareness in the community? Christina, would you please give us some highlights on breast cancer risk factors?
Sure. There's so many risk factors on getting a breast cancer, but I want to talk about top 5. As Dr. Maya has already discussed, age, and she gave you guys more detailed on when to screen. Family history is something that we cannot change. So if you have relatives or sister, mother, or relatives that has history of breast cancer, we recommend genetical testing and talk to your provider about that. Also, alcohol intake, increased alcohol intake. The alcohol increases the estrogen level that women do, and plus if you're taking hormone therapy like birth control, that increases the estrogen level of that also. We talk about age already. I can.
Yeah, those are. Thank you, Christina. Those are very important factors. Like she mentioned, if you have family members with breast cancer, please pay attention to that. Let your healthcare provider know that. If breast cancer is detected at the age of 45, the family member should get screening 10 years earlier than when it was diagnosed for the other family members. You should also look at your lifestyle. Was it healthy or unhealthy? Do you have low fiber diet or high fiber diet? Are you obese or you're in normal health? There are certain factors. The most important one is healthy lifestyle and family history. Now, this talk is all towards bringing awareness towards breast cancer screening, also to prevent the disease from happening, because prevention is always better than prevention is always better than cure. So I would like to have your support on this matter. November 17th, this Saturday, there's gonna be a walk for Nepal, and Kamala Shakya Foundation is putting this event together to raise some money to get funding for buying a mammogram machine for Nepal. Please take it as a privilege, not as a hassle. As a community, we all should put it together and come and support this. They not only need your financial support, they need your talents, your love, your time. Please come and make this event successful. Kamala Shakya Foundation in April lost a very dear and near family member. In the memory of that family member, her name is Kamala, they raised money to buy colposcopy machine. The fundraising was done in April, in May, and in June they got 2 machines to screen for cancer, and they sent those machines, they hand carried those machines to Nepal, and they gifted that to Dhulikhel Hospital. Now this event is again raise the money to get the screening tool, which is screening mammogram machine for Nepal, so we could detect the cancer in early stages and prevent from early death or premature death happening from poor diagnosis or poor screening. So please support us. Thank you.